Hello everyone. Welcome to Enzyme MBBS, where complex medicine becomes simple and exam ready. Okay, so without wasting any time, let's get started. Now, the difference between wound healing by primary and secondary intention, it itself has a 5 marks. So, when it is asked for 5 marks, you have to mention tabular column and explain it to get proper marks. But even when the questions are like explain wound healing by primary intention or wound healing by secondary intention, now there, even though differences are not asked, you are expected to write the difference there. So in those questions, just mention the tabular column, that's enough. But for 5 marks, you have to explain the tabular column. So let's start. So here is the tabular column. Now there is around 18 features you have to mention here. Now, the what comes under healing by primary intention and secondary intention, you can easily understand, and while explaining also, you can easily get it and you can write it. But the challenge here is remembering this 18 features. That's what takes little more effort. So for that, we have a mnemonic. So that is something like most common. In that most common, consider only M and C, the first two letters of the word. Most common CD game. We usually play many games by inserting the CD in the computer. We usually used to do it in a childhood. So most common CD game, win it. Now instead of win it, we will say win fit. Okay, so most common CD game win fit. CS homework, computer science homework. So there MC and the entire CD game win fit is mnemonic, and CS and homeworks HW. So if you observe, M is macrophage activity, C is collagen deposition, another C is cosmetic outcome, then D duration of healing, game G granulation tissue, A angiogenesis, M myofibroblast, I mean role of myofibroblast, E is example, then Win, W wound edge, I inflammation and nature of wound, Fit fibroblast proliferation, risk of infection and tissue loss. Then CS complication and scar size, HW hematoma and wound contraction. How it actually works in healing by primary intention and secondary intention, we are gonna see in continuous video. I mean in the upcoming video. So that's the tabular column. Now coming to the nature of wound. So it's in primary intention, it occurs clean and infected and surgical wounds and tissue damage is minimal, whereas in secondary intention it occurs in large wounds caused by trauma, burns, ulcers or abscess drainage. Extensive tissue destruction is present and wounds are often contaminated or infected. Next, degree of tissue loss. In primary intention it is very little tissue is lost, and only epithelial and minimal connective tissue damage facilitates rapid closure. Secondary intention, it has significant tissue loss involving epithelium, dermis, sometimes deeper tissue. Healing requires replacement of large tissue defects. Next, coming to the wound edges. In primary intention, wound edges are closely approximated, often sutured, stapled or glued. Secondary intention, wound edges are widely separated and cannot be approximated surgically. Now, see, I'm just reading this because all these are self-explanatory, right? Next, hematoma formation. Now, hematoma formation, the primary intention, the small fibrin clot forms, acts as temporary scaffold. Secondary intention, large hematoma is present, contains necrotic debris and inflammatory cells, prolongs inflammation. Inflammatory response, in primary intention, it is mild and short-lived. Neutrophils disappear quickly. Macrophage activity is limited. In secondary intention, inflammation is intense and prolonged. Large number of neutrophils and macrophages essential for removal of extensive necrotic tissue. Okay, and next it is granulation tissue formation. So granulation tissue formation, in primary intention, minimal granulation tissue just enough to bridge the wound. Secondary intention, abundant granulation tissue formation fills the entire wound defect, appears red, soft and granular. Angiogenesis, primary intention, limited angiogenesis and adequate blood supply is already present, whereas in secondary intention, marked angiogenesis required to supply oxygen nutrient to large healing area. Fibroblast proliferation and collagen deposition, primary intention, limited fibroblast migration, lesser collagen deposition and results in a thin scar. In secondary intention, extensive fibroblast proliferation, large amounts of collagen synthesis leads to a thick fibrous scar. Now coming to the wound contraction. Primary intention, minimal or absent, myofibroblasts play a negligible role. In secondary, it is prominent wound contraction mediated by myofibroblast and reduces wound size but may cause deformity. Duration of healing: primary intention healing is rapid and usually completed within days to weeks, whereas in secondary intention it is slow and may take weeks to months. And how is the final scar? In primary intention it is small thin linear scar and good cosmetic outcome. In secondary it is large irregular scar, poor cosmetic outcome. And risk of infection: in primary intention it is low risk due to clean wound and early outcome, whereas in secondary infection it is high risk, open wound exposed to contaminants. And last but not the least, complications: primary intention it is rare occasional wound essence or infection, whereas secondary intention it is common complications like chronic ulcers, hypertrophic scars, keloids, contractures, and exuberant granulation tissue. So that's all for this video. I hope it was helpful for you all. So if it was